Healthcare providers have now contracted the Ebola virus both here in the United States and in Europe. 22 News reporter Kate Walsh found out nurses are concerned here in Massachusetts.
There are protocols in place at hospitals, but one nurses organization is demanding maximum protection against the virus.
Every hospital in this country needs to think about the possibility of Ebola.
As the Centers for Disease Control investigates how a healthcare provider in Texas was infected with Ebola, National Nurses United is demanding more training and protection in hospitals.
There has been no coordinated training. There has been the hospitals, almost every hospital doesn't have hazmat suits for the nurses, doesn't have the right protective materials for the nurses. And more globally, we don't have a universal plan.
Governor Deval Patrick told 22 News the state is following protocol.
I respect the MNA. I know what they've been saying, but in fact, the CDC has issued those guidelines. Those guidelines have been distributed by the DPH broadly in the Commonwealth.
Despite the nurses' concerns, infectious disease specialists at Bay State Medical Center and other hospitals in western Massachusetts have told 22 News they have procedures in place and isolation areas set up should a patient start showing symptoms of Ebola. The MNA doesn't represent nurses at Bay State Medical Center in Springfield. In a statement, Bay State's chief of nursing said in part, "We have provided informational and material resources to our caregivers in as many ways as possible, including one-to-one education and a section of our internal website devoted to Ebola information." Both doctors and state officials said they still believe it is highly unlikely Ebola will become a problem in Massachusetts. Live in the studio, Kate Walsh, 22 News.